What happens if you scratch the eye? Tell me what happens.
So, usually if someone scratched the eye, there's some sort of history. People will come in and say, I was mowing my yard and a tree branch scraped my eye or something like that. So when I'm taking a look at a person like that, usually they come in, there's a sensation like there's something in the eye. Foreign body sensation, oftentimes very intense. The eye can be red, oftentimes tearing, just tears pouring out. And what we see in there's something called the epithelium. The epithelium is like the skin surface of something called the cornea. Okay, the cornea is like the clear dome of the eye. The epithelium is like the skin. And so what can happen is a little bit of that epithelium can get kind of scraped off.
Yeah.
And so if you think about it, the cornea has a lot of nerve endings. So all of a sudden you've got all these little nerve endings that are exposed to the air, and they don't like that at all. So it's a very uncomfortable situation.
So how do you treat that? If somebody scratches the cornea, first of all, how do you know that's what it is? Can you examine the eye and see a scratch?
So oftentimes you can just look in and see a scratch. There is something called fluorescein dye that we use all the time in the office, which can help kind of stain a defect in that epithelium.
And so that will bring it out. How do you treat it then?
So there's really basically three ways. If it's something really small, you could just give that person a little bit of ointment, and these things will get better on their own if you do nothing most of the time.
Have to put an eye patch on?
Another way is to put an eye patch on, a little pressure patch for overnight.
Why do you do that?
Basically that just helps provide an easy way for that cornea to heal. The downside of the patch, which I don't use very often, is you have a big patch over your eye. You can't see, it's uncomfortable.
You look like a pirate.
Well, if you know what, around Halloween it might work very well. But normally people don't really like the patch. And so a lot of times what I'll do is I'll put a little bandage contact lens, an extended wear contact lens on the eye. And if you think about those little nerve endings I was telling you about, what that bandage lens does, it provides a barrier between those nerve endings and the eyelid and the rest of the elements. So every time you blink, that eyelid's not just scraping along those nerve endings. And so it provides a nice environment for the cornea to heal, and usually that heals up very quickly.
How quick?
Well, it depends on the size of the defect. Overnight, sometimes a day or two.
Wow, so the eye's amazing in how fast it does heal. To me, it's one of the most amazing parts of the body.